As a teenager or a parent, you naturally don't just think about the cancer treatment itself, that is the therapy and its side effects, but also about possible long-term effects. These are effects that only appear after the treatment is over, maybe even many years later. Yes, when you or your child is already an adult. Your doctor will talk to you about the possible long-term effects, because they vary from person to person, you know. For example, they depend on the type of cancer, the kind of treatment used, how old you are, or how old your child is, and whether there are any other existing health conditions. But let's first take a look at a few possible long-term effects. Long-term effects can impact individual organs, right? They may affect, for instance, the lungs, the liver, the entire intestine, the kidneys, which you can't see here, they're just behind. It could be the cardiovascular system, the bones, the muscles, the nerves, and of course also the reproductive organs, and with that, fertility, that is, the ability to have children. And even if that's not a topic for you right now, yes, it makes sense to think about it before starting therapy, because it is possible to freeze egg or sperm cells for adulthood before treatment begins. In addition, some former patients suffer from fatigue, concentration issues, and memory problems as late effects of the therapy, that is, the treatment. And of course, the mind also often needs time to process what has been experienced. And yes, as a late effect, another cancer can also occur, what's called a secondary cancer, and that can happen many years after treatment. But once again, this is very important. All of these late effects can occur, but they don't have to. And it is absolutely crucial that despite all these late effects, there is no way around undergoing cancer treatment. The therapy is vital. That means you can't do without it, because cancer doesn't just go away on its own. But the good news is that you are in very good hands, yes. Your medical team is there for you even after the treatment, and for a very important reason, follow-up care. Meaning that you'll continue to come in at regular intervals even after the therapy. So your child or you as a teenager will be examined regularly, and then you can talk to the doctors again, because this way, health problems and changes can be detected early, treated, and long-term effects can ideally be prevented or at least minimized as much as possible. So be sure to take follow-up care seriously, okay? And not just in the first few years, but ideally stay on top of it for life. And of course, that also applies to the transition into adulthood. Yes, the so-called transition. Sounds rather complicated. Transition simply means that you basically move from childhood and adolescence into adulthood. So you basically progress into adult medical care. And at some clinics, there are even special follow-up care programs for that phase that you should definitely take advantage of.